I do want women to know that there is an alternative to suppressing their bodies with hormones, that they can see their body as a good and they can live in that body holistically.
Totally. Oh my gosh, it's amazing.
Join co-hosts Jamie Rocci and Theresa Kenny as they educate women about the beauty of the feminine design and empower women to take charge of their health.
They're going to be so amazing. You're going to be so empowered by understanding your feminine genius and your hormone genius. I don't think I could live my whole life knowing this and not sharing it with anyone.
Hello, welcome to the Hormone Genius podcast. And I'm here with Jamie today. We're in season 7. We appreciate you always coming into the Hormone Genius podcast to learn so you can be empowered to be the genius of your hormones. Today, we're going to empower you to be the genius of prepping for pregnancy. I know as a nurse practitioner, I'll have my patients come in and I'm always pleasantly surprised when a patient will ask me, Theresa, I'm going to be wanting to get pregnant in the next year. And I just want to know, what should I be doing? What should I be doing to prepare for pregnancy? And it's always an exciting question because I don't get it super often, but I want you out there to be thinking, have I ever asked that question? Am I thinking about being pregnant in the next year? And if I talk to my healthcare professional about what is it that I can do to have the healthiest pregnancy, and the first thing that we want to talk about is what we always talk about, right, Jamie? And it's the 5th vital sign. Jamie, why don't you start with telling us why it's so important to understand the 5th vital sign when prepping to become pregnant?
Yeah. It's so important, and I do agree. I think that the world is becoming more informed and body aware, which is good, but it is, we have a lot of work to do. So for those of you listening, if you're preparing to hopefully get pregnant in the next year, just ask yourself, are you charting your cycle? Are you aware? I always think of these 3 main things. If I'm talking to any woman who hasn't charted her cycle, I break it down into 3 things to keep it simple, and as also just to invite her to maybe download the Fem app, for instance, or meet with a practitioner for sure, a fertility care practitioner, Fem educator. What are your periods like? So the first step is, am I getting a true period? You're getting a true period when your flow goes from a light or moderate, and then it moves up to heavy, and then it goes back down again to a moderate or a light. It should look like a roller coaster, almost like an up and down. Or it can even start at the very top and then come down. That's a symbol or a sign or a clue that you are getting a true period. Then mid-cycle, you start to notice a characteristic type of discharge. So I like to break it down into red flow, white flow. So white flow is the second thing I ask women to notice. Do you notice a white flow or a cervical mucus discharge around the middle of your cycle? And if women say, no, I never notice, I'm not immediately worried. Sometimes we just don't notice the things that we're not looking for. So I ask, why don't you just look around? When I say look around, I mean notice when you're wiping. So after you go to the bathroom and you wipe, and you notice the sensation as you wipe, or even as you're walking around mid-cycle, around between days 12 and 18, and some less and some more, but around that time, do you notice kind of a lubricative sensation, kind of like egg whitey sensation? That is a sign that likely your estrogen is high enough to trigger your LH surge so that you can ovulate. So that's the second thing. White flow, do you notice it? And then the third one is I ask, if extra bonus, are you attentive to that white flow and then the number of days that follow the white flow until the next red flow? So that there are a number of days, it's the luteal phase, after ovulation that are very important, that it's long enough so that your uterine lining can be stable enough to maintain a pregnancy, even just in terms of implantation. So after ovulation, and actually during ovulation, if a woman were to conceive, that newly conceived life needs to implant into the side of the uterus. If the uterine lining isn't thick enough, and then there's a problem there. It's important that we understand the number of days because it takes time for that lining to be maintained. I'm really making this elevator pitch. Wise, Theresa. But those are kind of the 3 things. It takes a certain number of days after the white flow until the red flow. You want it to be around 11 to 14-ish days. That's a good stable luteal phase. And you should notice that range of days every month. It shouldn't waver a ton. And then you should notice your white flow. You should notice your red flow. high level. That's kind of what I start with.
Yeah. The reason why we call it the fifth vital sign is because it is something from a medical standpoint, we're looking at it a little differently. You have your period and you just think of it as your period. This is thinking of your period as a sign of the health of your reproductive system. Right. And therefore, we want you to just have a basic understanding of what the phases of the cycle are that are most important. And obviously, the most important thing about cervical mucus, Jamie, is that it is literally the third ingredient in order to create a conception. Mm-hmm. We often say this in talks we give. Why does a woman make this cervical mucus stuff? Why do we have to talk about mucus all the time? We get it. It's kind of gross. But literally, it's the essential third ingredient for conception to occur, because it takes two to tango, and we have another person involved in this whole conception thing, and that is a guy, and that guy creates sperm, and sperm are like little fish, and fish do not swim without water. Mm-hmm. And therefore, the mucus is essential in order for us to have conception. It's just important that you pay attention. That is one of the most important things for you to pay attention to. Okay, women do not get this education. It is not shocking that women would think there's something wrong with them if they have this discharge, but it is the most important thing to your fertility. So there, we'll start there. And just to kind of go back, Jamie, women might be thinking, well, how many months do I need to even be preparing for, is it a year? Do I need that much? Well, I think the minimum out there people will talk about is 3 months. We hope that you take 3 months almost to kind of prepare for really getting your body and understanding your cycle and everything in order to be right with pregnancy. But it may be longer. And I think if you're someone who already has some health issues, maybe you have a thyroid issue, maybe you have polycystic ovarian syndrome, or now PMOS, maybe you have endometriosis or painful periods at least. If you have a health condition, particularly if it's related to what you think of as your fertility, you're going to be taking longer. And the other thing that we might want to suggest is that what is the expected time once you do try to get pregnant that should happen in that's normal? For those, it's an interesting conversation because with charting, we've learned so much about what is normal and not normal. Charting is a window into a woman's body, and it's given us so much information. If they knew where their fertile window was, that they would become pregnant quickly with normal fertility. So this is kind of where it came. We got away from really saying you have to wait a year before you ever go to a doctor to find out what's wrong. We really backed that up to 6 months. Yeah. Because we realized that if you know what your window of fertility is, you should be having a conception if both partners in that story have normal fertility. And so that's just something to talk about. But we also know, and we're going to bring in men to this too, Jamie, kind of throughout, but especially as we start going into the next section of building a healthy foundation in our bodies. That's going to be what we're going to talk about next. But men, I want you to be thinking, my guy should be thinking about this too. This isn't just a woman's thing. Really fertility, again, is a two-party story. So we want men to also be thinking, because women have all the eggs they're going to have for a lifetime. We got to care in some ways a lot more, because it's harder for us to kind of like go back and fix, in a sense, sometimes what has happened, because those eggs have been there since we were in our mother's tummy. Mm-hmm. Men are different. They kind of get a little bit of a reset, right? Like their sperm renews every 70 to 90 days. And because their sperm also are more fragile, in a sense, to the outside world, it's probably good because, they can kind of take some assaults, but they get to renew those every 70 and 90 days. But Jamie, let's start out on building a healthy foundation for both men and women in terms of what we can do to really help kind of get those sperm and egg ready.
Yeah, definitely. I think about if you're preparing for pregnancy, and what percentage of your day is filled with actual whole food? It's just filled with actual whole food. Sometimes I think we get so into making sure our macros are right, and how much protein am I eating, which is a great question. How much fiber? What are my carbs like? What are my vitamins like? All these things. But in what form are we getting those foods? Is it highly processed? So my first encouragement is to eat a whole foods diet. Now, there is something called what is it? The whole food diet, whole 30. Yeah. Whole 30 is what it's called. Yeah. And there are rules kind of surrounding the whole 30 diet. So whole 30 diet's fine. It's a little restrictive. I like a whole food diet, as in is your food, was it alive once? As in, was it alive breathing because it was a farm animal? Was the tomato on a vine? Was the apple on a tree? A whole food diet. So I would encourage all women and men just to cut out their processed foods. There's so much garbage in processed foods. Even if the macros look right, let's say it's like a gangster, protein bar. If you look at the ingredient label and there are more than 5, they always say 5 or less, that's a plus. Like that's a good food. But if it's more than that, you've seen it all. Look at your ingredients. If it's like 10 plus with a bunch of words you don't understand or know, I would encourage people to take a pause in terms of consuming those foods. That's tip number 1, is just be aware of what you're eating throughout the day. And are your foods mostly processed? I like to follow the 80-20 rule too. Some people feel very confined when there are a lot of rules. So if 80% of your day is whole food and then 20% maybe you have a mac and cheese or something, or you eat a Snickers bar on a Sunday or whatever, but the 80-20 rule I think is really smart. We do want to get healthy fats. It's very important. In preconception, healthy fats, you want adequate protein, and of course complex carbs. Are your nails wobbly? Is your hair thinning? And we could talk about labs later on too in this episode. That's where I would start, Theresa.
Well, just from a research standpoint, Jamie, there's one diet that kind of holds itself up actually as being the most at least studied that could improve fertility. And there was a study done in 2023. It was actually a meta-analysis of over 36 studies. These were observational studies that showed that greater adherence to the Mediterranean diet showed the strongest and most consistent association with improved pregnancy rates. If you don't know what the Mediterranean diet is, you think of like the Italian couple, like, I always think of, in some ways, and I said this to a patient yesterday, it's not just what they eat. It's a little bit of a lifestyle thing too that goes with it. It's eating really high quality whole foods, high quality proteins, but olive oil we think of, and nuts and seeds and fruits and dairy. And it's just kind of like, imagine walking in Italy and just being like, what would they serve you? And that's the Mediterranean diet. And it goes with just a relaxed feeling too, maybe a glass of wine with your dinner and a walk after dinner. And so it's almost like it's something that I think we can all kind of strive to in the United States is being a little bit more Mediterranean in a lot of ways. So I think that's a good one to also recognize too. And so Jamie, let's talk about, you brought us some really great things, but in terms of those nutrients, that come from whole foods, what are the most important nutrients that we can think of that, we really should be thinking, am I getting enough of this to prepare my body for conception?
Yeah. Well, we've heard it a million times, but folate and folic acid, we always want to make sure. And often, like if you're taking a multivitamin, look to make sure you have enough folate or folic acid. You need about 400 to 800 micrograms daily. And sometimes you just aren't getting enough folate and you just need to add the folate. So add the folate if you're not getting enough. And there are prenatal vitamins that are awesome. We Heart Nutrition. We partner with We Heart Nutrition and they have incredible supplements. So again, if you're not getting enough folate in your diet, then you can, of course, supplement. And most people do. Prenatal, weheartnutrition.com. You can actually even use our code GENIUS for 20% off of your prenatal vitamins. But that is a great addition. Iron is a big one. So you're going to need more iron because there's a lot more blood flow when you're growing a baby. So you need a ton more iron, iodine, vitamin D, choline. Eggs are a great source of choline. And then DHA, omega-3 fatty acids you often see on prenatals, like, the prenatal, and DHA, it's great for neural development. So brain health for your baby. And in terms of these like vitamins and micronutrients and all of this, I think that's where some women get into trouble in terms of being overwhelmed. So I do really always just encourage somebody to just find a really good prenatal vitamin rather than think about each and every one. Just make sure the prenatal vitamin has enough or not too much, of these nutrients. Theresa, with you, when you're working with these women and thinking about vitamins and minerals and all these things, what are some labs, that you might recommend women look into if it's taken a while for them maybe to to get pregnant, or they're really wanting to be good and prepared before they achieve pregnancy?
Yeah, if we think about just the nutrient aspect too, I mean, one thing is, I mean, there's a lot of things we'll test. If someone is like, I want to be proactive, absolutely, like, I love it, let's do it. And you can test a few vitamins in standard labs that just gives you an overall sense of someone's nutrient status. So I always test B12, iron levels, vitamin D, magnesium is kind of a standard. And then if they're depleted, they're usually depleted on several of those things. It's not like it kind of goes with the same story. Although I would say some people, don't take a lot of vitamins, but they might take vitamin D and they take zinc, and so their vitamin D might be fine, but their B12 is in the tank and their iron's in the tank. So those are just some nutrients that we really can focus on. And I think you're right, Jamie, a good prenatal vitamin. And we kind of, we're trying to be as holistic as possible, try to get an organic one and then use a good brand like We Heart Nutrition. But there's a lot of good brands. And, ask your friends. I'm trying to look for a methylated prenatal vitamin. That means, if you don't know what methylated means, it just means that the nutrient is in like it's already broken down form. Just like if you would eat something off of a tree, it's instantly going to be used in the body because it's already broken down into that natural form. Folic acid is more of what we call the man-made form of folate, but you can get folate. And is folic acid harmful to people? For the most part, absolutely not. And so if your prenatal has folic acid, please do not panic about that. Or it might have a combination of both. Great. But you can, look for these organic ones. They probably are higher quality, more bioavailable in the body. So other labs, that we think about, well, most important, are hormones and thyroid. Are your hormones normal? And does everybody have to test their hormones? If you have a regular cycle, and as Jamie at the beginning said, you have a regular luteal phase, a regular mucus cycle, a regular period with no pain, no, you don't have to. But could you go and get your hormones tested for somebody that, like me, who knows how to test hormones, which unfortunately there's not that many people? Yes, absolutely. Thyroid is so important. And we are learning more and more about how important the numbers, even with testing thyroid, are. Like really, really having optimal levels of thyroid hormone, which is a huge player into the development of the baby and its ability to be maintained, prevention of miscarriage. But it's also important for like checking, even if the woman has autoimmunity going on. Hashimoto's is a common condition, and that can create more inflammation in the body. And of course, the goal of a healthy body is to be as least inflamed as possible. And there's a lot of things that affect inflammation that we have kind of going against us. So thyroid is important to have tested. Vitamin D, again, would be very important to be tested. And then progesterone and estrogen is very important, especially to be tested in the luteal phase. For a basic test that anybody can do is just identify your peak day, which is the point of ovulation, with whether it be cervical mucus or LH testing strips or with body temperature. A week after ovulation, or what we call a peak +7, is an easy way to just assess the overall health hormonally of a cycle. And that can be done in anybody. And then we can say, oh, that looks great. Or, oh, that doesn't look quite right. Let's dig into that further. Let's look at your charting. Let's see if there's any other testing that we can do on your hormones. So those would, I would say, be the basic
PMOS.
PCOS, but now the PMOS, it's polymetabolic endocrine disorder. Then you're looking at testosterone levels, DHEA, FSH, LH. There's some other hormones, prolactin, that we look at for fertility as well. These are all easy to do. And, if you have a condition like PMOS, there are strategies, very easy, holistic strategies that you could to get your body better prepared for pregnancy.
Earlier on in my fertility care practitioner years, it would seem like progesterone would be the sneaky little thing keeping women from getting pregnant, as in women didn't have enough progesterone. Mm-hmm. So that's just important, ladies. We need progesterone to maintain the uterine lining. But now I feel like it's shifting, or it's not necessarily shifting away from progesterone, but now we're giving a lot of attention, which is good, to our blood sugar levels, insulin, all these things. So our metabolic health is very important. And I think it's also very sneaky in that, our sad lifestyle diet, in America, it just is easy to be metabolically unhealthy. So that is something for people to consider and think about.
Estrogen levels. We're looking. This is becoming a fascinating research is how important estrogen is, and I think, of course, we've always thought and known progesterone is so important. And you're right. You're like, duh. Like, make sure your progesterone is normal, but we're finding that estrogen is synergistic with progesterone and actually may be a risk factor for miscarriage if your estrogen levels aren't high. And I had a dear friend whose daughter was getting pushback from a person who was testing her progesterone levels to not test the estrogen, that it had nothing to do with anything in the luteal phase. And I just frustrated by that because no, estrogen and progesterone are very important. And we have treatments to treat both of those, including, looking at also this hormone called DHEA, which has to do with egg quality. There's research on DHEA improving egg quality. There is some pioneering research around DHEA and prevention of miscarriage as well. And so, we've talked about this book, It Starts with an Egg, but I was just re-looking at that data. It comes up, DHEA improves markers of ovarian reserve, including FSH levels. It improves diminished ovarian reserve. And DHEA and CoQ10, those two probably have the most clinical evidence for improving egg quality, Jamie. And I was surprised by that. The CoQ10 gets brought up both for women and men. And if you don't know, CoQ10 is a vitamin that is an antioxidant, and it's also referred to as ubiquinol, but it does help, it looks like, kind of alone improve egg quality, but it can be combined with like vitamin D and other antioxidants to improve egg quality as well. And I'm not saying that this is like extra stuff. But if someone who's like, I'm doing a deeper look and I want to kind of do everything I can, or maybe you're over 30, right?
Yeah.
You know, Jamie, that 90% of our eggs are already used by 30.
Oh my goodness.
That you're in the last 10 to
oh my God,
12% of your egg. And this just makes sense because I often tell my patients, hey, you're most fertile literally like in your earliest 20s.
Yeah.
And by the time you're 28, your fertility starts to decline. And by the time you're 35, it takes a deep dive off a cliff. So like, and it's not to say that if you're in your 30s, I'm not trying to be a doomsgloom here, but I'm just saying like there was a campaign by the March of Dimes back in the 90s that said, women, there is a biological clock. Like this is a truth that we know fertility rates decline after 30. So if you're thinking about having children, please, think about that in relationship to what your fertility goals are, to not maybe wait, to make it easier and have you have more quality eggs then.
Right. And with the eggs that you have remaining, we want to make sure, that we have a good shot at having a good, healthy ovulation and a good, healthy baby. And there is so much to our lifestyle and what we can't control, but then also in ways we can influence our health. And that's, again, why we talk about how, and It Starts with the Eggs talks a lot about that book. It's so good. But about how, as you mentioned at the very beginning, 3 months, you have 3 months. When I ovulate this month, the process actually started 3 months ago. The health of my ovulation today was really started 3 months prior. So that gives you some sense of like, okay, I'm going to start this month and I'm going to be really good about decreasing my processed foods and really getting movement and exercise, all these things. And hopefully in 3 months, there will be a big impact on my egg quality and my ovulation. But yes, that's so true, just about our fertility, and to not discourage anybody who is still trying, because there is still things we can do to help improve our health.
Yes, and ask about the DHEA. If you're in that category, ask about the CoQ10. Talk to your healthcare professional. Look at the research.
Yep. What about HCG? Do you give HCG to your client?
I do. And that's a very specific treatment, Jamie. HCG is, but it's an incredible treatment. And you would certainly have to be working with a restorative reproductive healthcare professional probably to access that. But the reason why HCG is such a beautiful treatment is it is the pregnancy hormone. And guess what? When you're pregnant, your body intuitively pushes your body to make the appropriate hormones for pregnancy. But we actually made it into a medicine. So if I am not making the appropriate amount of hormones to support pregnancy, you can actually give HCG as a treatment to influence what we call the corpus luteum to make better estrogen and progesterone levels. It's an incredible luteal phase support treatment, Jamie. And yes, I do use it, especially in my patients with risk for infertility and miscarriage. That's something, again, that you could discuss, especially if you're in already a category of sub to infertility at this point. And Jamie, maybe we'll stop for a moment and you can go through our sponsors for this episode.
Yes. So as Theresa said, we are in season 7 and we're so excited. And we've become visionary partners with Facts. So Facts About Fertility, you've heard of Facts About Fertility before. We've had Dr. Dwayne on a few times actually throughout the years. And we're just so excited about the work Facts is doing. If you are a med student, if you're a medical professional, and you're looking to get connected to a community of just mission-aligned, vision-aligned medical professionals who really want to promote and educate their patients about fertility awareness-based methods and all the science around that, please check out factsaboutfertility.org. Check them out if you haven't already, especially if you're a medical professional. We love Facts. Also, we mentioned We Heart Nutrition. So just a reminder, Genius for 20% off of your order at weheartnutrition.com. They have prenatals, they have magnesium, they have probiotics, they have iron supplements. So really great there. Also, Wonder Cow. We love Wonder Cow colostrum in terms of inflammatory support or anti-inflammatory support for colostrum, taking that for our immune system. So check them out and you'll get 30% with the code Hormone Genius.
Actually, lastly, Jamie, if you are struggling and you want some help with your gut health, check out Fiat Institute and their hormone coach directory, because Jamie's got a whole bunch of really highly trained hormone coaches that can help you with all of the things that we're talking about today. Like literally, I cannot think of anyone better but Fiat Institute and their hormone coaches to really help someone prepare for pregnancy. It is truly kind of all the things that you would do in order to become pregnant is to get a hormone coach. Check out fiatinstitute.com, a hormone directory, easy to find. You can, find who's in your area or just find who looks like that would be a great fit for you, or email us at thehormonegenius@gmail.com and we'll help you. So Jamie, let's talk about other lifestyle factors, because we all know like these environmental things and egg quality and just, hits even on sperm, I was looking into, and I know you know some about this, the sperm DNA fragmentation, which are like a little salts to the sperm that can occur. All of us need to be aware of what is creating inflammation or what we call reactive oxygen species, oxidative stress, it's often referred to. And a lot of this can come from environmental stressors. And so, what are the things that you think of, Jamie, in terms of preparing for pregnancy that we can do to reduce our exposures to toxins and endocrine system disruptors?
I often think about what inputs do we make throughout the day the most and start there. So what input do I put in my body or on my body throughout the day? Water. We need water to survive, people. So if we need water to survive, we should be drinking about half our body weight in ounces of water. We want to make sure our water is clean. And then we think about like the microplastics, but that can be overwhelming to people. I always think about filtering your water, and you can do something simple. You don't have to spend hundreds of dollars on a Berkey. You just don't. We bought a Culligan pitcher, and that's what we use. And maybe we replace the filter more than we want to, but it's the trade-off we make by just having something super simple and easy for the kids to access. It's just a big pitcher, and we filter our water. Especially if you live in the Midwest, there's more and more research coming out about cancer rates, our drinking water. We're an agricultural community, and I don't need to go on and on about that, but it is true, especially in the Midwest, you really should filter your water. Okay, so that is one really important, and I would say probably one of the most easy, beneficial things you can do for your health, because again, the input is high. Hopefully you're drinking enough water. If you can get a stainless steel water bottle or a glass water bottle, extra bonus, in terms of these really inexpensive, like 24-pack water bottles you get at the Dollar Tree for $1, I would say don't do that. Steer away from the plastic water bottles. Just buy yourself a nice stainless steel. It doesn't have to be expensive, or a glass water bottle, and really try to dedicate time on that. Because like I said, there's this 3-month thing, right? So for these 3 months, give yourself these 3 months chunks of time and just tell yourself, I'm not going to drink from a cheap plastic water bottle. Also, too, something that I want to get better at, and I've seen some influencers, I think it's called ozone cleaning your vegetables and fruits. It's like this bubbling thing that you put in your sink, and it's really just cleaning your produce. But that's something else. You could even just put a little bit of baking soda in a big bowl of water and even a little bit of vinegar, or I like to use lemon essential oil, and then let your food just sit. It's crazy what is on your food. It's crazy what's on your food. Washing your produce thoroughly. And again, that doesn't cost hardly any money. But making sure that you're thinking about what you're putting, again, on your body, in your body inputs. One of the biggest assaults in your home in terms of like carcinogens, but just even high toxic load are fabric softeners, Theresa. Fabric softeners. So when we think about fabric softeners, we think about they go in the dryer. What is the dryer? Well, it's hot. And then when that's happening in the heat, that means that there's they're flying out of the fabric softeners onto your clothes. So that means you're wearing the fabric softener, especially if it's scented. This is something that's simple. Just ditch them. Don't put them in your dryer. Just don't. I'm trying to think of some simple, easy things. Again, water, filter your water. Don't dry your clothes with fabric softeners. Start there.
Yeah.
But just be mindful, again, of the synthetic fragrances.
Yeah, just think of
plugins.
Everything in your house. I mean, like your cleaning products, right? Jamie, I know what you're cleaning with, what you're washing your clothes in, what you're washing your hair with, your body soaps, your makeups, like all of those. Go to the environmentalworkinggroup.org/skin deep or get the Yucca app or Trash Panda. There's all of these new things that can help us kind of see what's toxic, what's not toxic. We've done a previous episode on endocrine system disruptors. It gives a lot more information. So it's just the point is you can't get away from all toxins, but you can reduce your overall exposure. And then we don't want you to freak out about it, but we just want you to start to think in that clean air, clean water, clean skin, what you put on your skin. You can get an air filter for just your bedroom, a cheap one for $100, we have them in all the rooms that we're just sleeping, 8 hours. Think about that. You're sleeping 8 hours just breathing in the same air. Like an air filter in at least the bedroom would be a very simple, easy step to make your air even cleaner, which is important. And all of these things, again, go for men too. Don't smoke. Don't drink. These are also toxins, right, that we just easily avoid. Think about it. It's common sense, obviously, those things. And marijuana. I mean, this is the more kind of drug of choice, I think, for a lot of people these days. It seems healthier on some levels, but marijuana is literally known to harm fertility, harm sperm counts, harm sperm motility, and it's not good. If you're thinking about becoming pregnant, please stop that within those 3 months and give your time to recuperate from those toxins. Other things that we can do for preparing for fertility or pregnancy: sleep. Prioritize sleep, regular exercise. I mean, just the standard, this is like the government's recommendation is like 150 minutes of exercise or activity daily. That's a good place to start for anybody if you're not exercising. But you've got to be able to get enough rest and enough activity to continue to signal the right circadian rhythms, in a sense, to the body. Circadian rhythms, we know, are so important. We've talked about those several times on our episodes, particularly with Tiffany Cagwin. She was great. Really letting your body kind of be in this beautiful rhythm of health, the regular exercise, healthy stress levels. Now, this is always the elephant in the room when it comes to becoming pregnant, especially if you're struggling, is there stress you need to deal with? Of course there is. Human beings have stress, some more than others, though. And what can you do to help either cope with the stress or get it off your plate? It's very important to prioritize relationships and family, and building a family is something that's the most important thing in someone's life. So if stress is impeding that, and there's something that I could probably get rid of this, but are just afraid to, maybe today's the day you say, you know what, I'm going to take care of me and my future family even, and really prioritize myself in terms of getting stress out of the way. When, especially, it could be a relationship that's stressful. It could be your work that's stressful. There's lots of situations we need to look at and say, hey, I need to make a change here.
I have a friend who'd always get so frustrated when people would tell her to just not worry about getting pregnant. Mm-hmm. Just don't worry. Don't think about it so much. She'd get so frustrated. And the whole story of when these people stopped trying is when they got pregnant. This was such a frustrating story she would hear often from people. And it's not one person. We all hear people say that all the time. She get frustrated, and she said it finally started to click when she understood that stress is kind of a hierarchy process. So if the body is not feeling safe, it's going to shut down all secondary functions. What are secondary? Well, what are primary functions? Primary functions, well, we need to breathe so we can live. So our lungs and our heart and our brain, these things need to be functioning. We need to eat and drink water. So we need to survive. Okay. But primarily it's like our heart, our brain, our lungs. Secondary is digestion. So we don't need to necessarily, we might not feel hungry actually if we're super stressed, because our body isn't like, oh, eat food now. Our body is like, I don't feel safe now, and my body's preparing to run from a bear, because again, the inputs are causing stress on the system. She said the thing that made the most sense to her when it comes to just don't worry about it, this and that, she had to understand the science of stress. And then she started realizing, oh, it's because when I'm stressed, there's a hormone cortisol that increases. And cortisol turns off the secondary function, in a sense, of fertility. It can do that. So the body may not ovulate because it's feeling stressed, because we do not need to ovulate when we're running from a bear. Instead, our body feels, the blood flows going to our muscles, and it's kind of, we're thinking, how am I going to escape? Our heart's pumping, we're perspiring. There's all these symptoms. And so some people can be in a chronic point of stress, or a chronic stage of stress. But she gave me advice, never, ever, Jamie, say that to anyone you're working with. And I never have, because it's just so hurtful and insensitive. So that's why people say, if you stop worrying, it's really just the stress hormone that can impede ovulation.
That was a great explanation, Jamie. And you're right. Like, we want everyone to just know, I mean, we love you all out there. We want to help you, and we never want to be insensitive to the fact that we realize these things are difficult, and not becoming pregnant when you want to become pregnant is one of the most difficult things ever. So how we approach that in those discussions is just very important. So Jamie, let's kind of tie up any loose ends. I'm going to go through just a preconception checklist here, kind of all the things that we've talked about. The most important thing to start with is your fifth vital sign, learning how to chart the cycle, and then being aware of what is that cycle telling you? Is there any clues that your cycle may not be healthy? I may not have enough cervical mucus. I may have an abnormal length cycle. I may have very painful periods. Whatever it is, that's your fifth vital sign. That's where you start. Begin to think about your nutrients, and a simple thing to do is to start a prenatal vitamin, because it takes the worry out of knowing that you're going to get enough, especially when we think of things like folate, which is so important to a developing baby, iodine, which is for the thyroid, which we may not be getting enough in our diets. That's a very common deficiency right now. Iron, vitamin D, choline, omega-3 fatty acids, all of these can be taken care of in a prenatal. And so look at possibly starting that at least 3 months before attempting to conceive, but even longer is fine. Your spouse, person who you're planning to have a family with, they should be on a good multivitamin too. Their sperm needs selenium, zinc, omega-3s, B vitamins, all of these things too. And a guy, I always say, like, I'll look at the couple together. I'm like, well, are you taking a prenatal, mister over there? Or, are you taking a good quality multivitamin? And guys can take prenatals too. They don't have to. They can just get their own, but that would not hurt them. Important to think of them too. Schedule a visit with your healthcare professional to talk about preconception. Bring up your concerns. Do I have any family history of issues that I might be concerned about? Is there genetic issues? Is there, things that I'm just kind of like, worried about? Bring those up to a healthcare professional and talk about your own health issues. Am I at a good, healthy weight? Is this enough exercise, or is it too much exercise? Am I eating the right nutrition? These are all things that you can talk about with your trusted healthcare professional. Review the medications that you're on. We didn't really talk much about this, but if you are on medications, particularly if you're not sure if they would be safe for pregnancy, then this is something that definitely, months before you attempt to become pregnant should be reviewed with a doctor. Is this something I can stay on? What's the risk versus the benefit of being on this medication? That is an incredibly important thing to do with a healthcare professional months before you become pregnant. Obviously, eat a whole food diet like we talked about, protein rich, maybe the Mediterranean diet. prioritize sleep and stress. Go to the dentist. Jamie, we didn't talk.
Oh, yeah.
He just did a great episode with Dr. Katie Lee on your oral health and how it affects your fertility, how it affects everything. And so if you're not getting regular dental exams, you should, because that's a place where things can hide, especially when we're talking about inflammation. If you have an issue, go to the dentist, get that all cleared up before becoming pregnant. Reduce smoking, alcohol, marijuana use, all of the environmental toxin exposures, and encourage your partner to do all of these things as well.
Yep. The only thing I'm going to add to, Theresa, and post-birth control. So if you're on birth control.
Yes.
If you're on birth control, of course, discontinue. And we say typically a woman is, quote unquote, post-birth control, like 6 months to a year after being on birth control. There are different forms of birth control. There are different levels of hormones and whatnot. So 6 to 12 months, of course, that you hear people who get pregnant right away. You hear people, it takes a while. There's so many factors that influence that. There's so many factors. We do, as Fiat Institute, we have a post-birth control kind of recovery program. So we can reboot your body. We can think about your gut, your nutrient stores, because birth control can wreak havoc on your gut. It can impede the ability to absorb certain vitamins. And so hormone coaches can help you. Go to the directory on fiatinstitute.com because that will be important to know.
Yeah.
Right. Well,
I'm so glad you brought up that one, Jamie. That's a big one. We kind of like sometimes don't think about birth control because we're always in the mindset of charting a school already that we forget. You know, there are a lot of you that are on a birth control and maybe you're like, oh my gosh, when do I come off of this? So yeah, I mean, at least 3 to 6 months, you know, mostly just you got to learn your cycle. With charting, how do you got to learn the natural rhythm of the fertility cycle, and you need a few months to do that and to also know if anything looks abnormal. So great one to bring up, Jamie. Thanks so much for doing this episode. I hope it's helpful for people. Anything else you want to share, Jamie?
No, just, you know, we're here for you. Just like Theresa said, we love all you so much and we just care for you. And we would love to help answer any questions if you have them as they come up. And Theresa, we'll see you in the next episode.
Thanks for listening to the Hormone Genius podcast. Please remember to share our podcast with your friends and family and also follow us on social media. If you were not aware, we have a YouTube channel. So if you could like and subscribe to our YouTube channel to stay in the loop with all of our latest episodes, we would appreciate that. Thank you so much for your support. We are excited to journey alongside you as you discover the beauty and the genius of your hormones.